While Washington legislators debate over health care reform, New York faces its own battle. In order to close the state budget deficit, Governor David Paterson has proposed health care budget cuts that would affect not only the industry's workers, but also the most vulnerable.
Seniors, for example, SSI right now, which is the state supplemental security income, is an issue in the sense that they are cutting about $11.4 million. Now you say that's not much, but it is a lot when the persons are receiving $761 a month.
And the SSI program for those with limited income resources is only one of the areas that are going to be affected. Hospitals also receive Medicaid funds.
But there's going to be a lot of providers that are going to be losing a lot of workers. And that affects the economy, it affects all areas, you know, and where are they going?
Medicaid, the federal state health program for the poor, is the most expensive piece in the state budget, followed by education. In fact, New York's Medicaid program is the most expensive in the nation. The controversial cuts come as a response to the estimated $4 billion deficit the state faces in the current fiscal year, which ends on March 31st.
We have more and more people coming for emergency rent or for advocacy in terms of keeping their apartment, seeing how they're going to keep it in terms of how they're going to pay their rent and the subsidies. I know that there's a deficit and we know that there's a lot of issues. Where do we cut that really doesn't have to hit the most vulnerable of the poor?
Governor Paterson has said the cuts are necessary to deal with the budget crisis and to avoid an increase in taxes.